In this video series, we will discuss 5 key elements in the Tobacco Intervention Program. These are known as the 5 A's. The first video segment will review the patient's information and introduce her to our audience. We will also begin the first step of the intervention, ask, by asking our patient if she is ready to quit. The second segment will cover the next step, advise, in which we will discuss different evidence-based risk factors. The third step involves our assessment of the patient to determine if they are ready to quit and what it will take to make them successful. The fourth step requires that we find how to best assist the patient during their journey to quit smoking. We will also review possible pharmacotherapy or drug methods that can help in quitting. In our last segment, we will arrange a follow-up meeting with the patient to assess their progress as well as troubleshoot any barriers to their success. We will end the intervention with an encouraging word and provide resources for the patient's personal review. Welcome to the Nashville Premier Women's Health Center. My name is Dee Dee Stover. In addition to being a registered respiratory therapist, I'm also a certified tobacco treatment specialist in this OBGYN office. My patient today is 32-year-old female Willa Aspen. Before sitting down with Ms. Aspen, I have pulled her medical record and health information for review. Her OBGYN has ordered that she be screened for tobacco usage. Her patient history assessment and survey revealed that she has smoked 2 packs of cigarettes each day since she was 19 years old. She admits to smoking during her last 2 pregnancies, which both resulted in premature deliveries. Her last third pregnancy ended spontaneously and prematurely. She is documented as a Gravida 3 Para 2 patient.
Hello, Ms. Willa. My name is Dee Dee Stover. It's a pleasure to meet you today. Hi. I just want to encourage you, first of all, let you know this is a wonderful, safe place. We're so excited here at the Nashville Women's Premier Health Center to have you here. We are very big supporters of women's health, especially for women who are pregnant and expecting, and for those women who are wanting to make greater changes for their health. Of course, we're here today because your doctor wanted you to have a tobacco screening, and that just means that we want to help see if we can help reduce your exposure to smoke. I know that you currently smoke, and there's been some difficulty getting off of that habit in the past, but I just want to encourage you today that this is all about you, your health, the health of your baby, and we here at the facility, we all support you. And we just want you to feel you're in a good, safe, comfortable place. To be honest, there's no judgment. And this is really just about you. So don't feel embarrassed. Don't feel like there's too much spotlight. This is just about us teaming together to help make sure your baby comes out as healthy as possible, as much as we can help, and that you're doing everything that you can do as well. So I hope you had a safe drive in. That was a big distance for you. I just want to go over some things that I found in your chart. Of course, you have your medical history and some things about your past pregnancy. But I see here for today that you've already indicated with us with our Are You Ready to Quit form. You've indicated that you still smoke, but you've been cutting down. But I first want to ask you, are you still willing to quit smoking?
Yes, I'm not ready.
Okay, you said you're ready. That's wonderful. Okay. And like I said you still smoke, but you've cut down. Can you explain a little bit to me what that means for you?
Well, I used to smoke 2 packs a day, but I'm now down to 1 pack and sometimes 1.5.
Okay, so we're working on that's wonderful. You know, it's important to start somewhere, and the first step is admitting that there's a problem that we can hopefully fix, and we have our resources here to hopefully help you do that today.
Based on the information Ms. Aspen gave me, we continued our discussion and reviewed what we would be going over during our session today. I let her know that we would go over why or why not she's ready to quit, but you already heard that she is ready. We also would go over the different real risk factors that have to be kept in mind as she quits smoking. We will also determine what exactly will need to take place to help her quit and see if counseling or any medical drugs can help her be more successful. The last thing I'll do is confirm a follow-up date with her and make sure that she has access to all the resources that she needs. I asked her if she had any questions, which she did not, so we're ready to begin. I documented her current smoking status in her vital signs assessment chart, and we're ready to start.